talking about IVF step by step. I am Dr. Gunjan Gupta Govil, Director and Founder, Gunjan IVF World. I am a fertility, IVF and a laparoscopic expert. Today, I will explain to you about the steps involved in IVF or in vitro fertilization, or commonly known as test tube baby. So, before I begin about IVF, I would like to tell you about what is the natural process of conception or having a baby. What happens is that in each menstrual cycle, the day you begin your periods, around day 2, day 3, the ovaries are given a job of recruiting the eggs. So one of that egg grows and matures around the time of ovulation, that is around day 12, day 14, depending upon your menstrual cycle, and once it is mature, it releases. At that time, once the sperm meets the egg, what happens? These eggs are picked up by the fallopian tube from the ovary and it enters into the fallopian tube. Simultaneously, the sperm travels through the vagina, through the uterine cavity to reach the fallopian tube. So once it is there in the tube, the sperm meets the egg, fertilization occurs, and then this fertilized embryo gradually rolls down back to the uterine cavity and it sticks to the uterine wall or the uterine layer, which we call as the endometrium, and then the pregnancy grows, and that is how a pregnancy is achieved. So what happens in IVF? In IVF or in vitro fertilization, vitro stands outside. So this entire procedure is done. That is, the eggs are taken out, they are fertilized, and the embryos are formed, and then they are placed back inside the uterus. So the entire process of fertilization occurs outside the human body, and that is why the name test tube baby also came, because in common man's language it was as if the eggs have been fertilized in a test tube. So that is why we call it also a test tube baby. Or vitro means outside human body, so it is a fertilization outside human body. So what are the steps involved? First step involves an evaluation of the couple, that is both the male and the female. We need to evaluate firstly the female to check for her hormones, her hormonal levels like anti-Mullerian hormone, prolactin, thyroid. Do an ultrasound to check for her uterine cavity to see there are no other diseases like fibroids or cyst or endometriosis. Check for the oocyte number, what we call as antral follicular count, to rule out any infections, etc., etc. Also, the males are checked to look that the semen count is proper. What is the count? What is the motility of the sperms? What is the shape, size, structure of the sperms? How many normal sperms we have? And so that we have a proper plan laid out whenever we are planning to undergo IVF. After we have made a plan, the procedure starts on day 2, day 3. So this procedure is called as ovarian stimulation. It involves injections of hormones given for almost 9 to 12 days to help the eggs to mature or the follicles to grow. Follicles are the egg sacs which have oocytes in them. So they are given in a sequential manner. Usually the ovarian stimulation process involves a baseline ultrasound which is done on day 2, day 3 of the cycle when we are starting the stimulation to rule out that there is no other problem, and then after 5 days of stimulation injection, usually a reassessment is made and dose and other injections which need to be added are modified accordingly. And then depending upon the maturity and development of eggs, sequential scans are done every 2 to 3 days. Once the eggs are mature, that is generally we say a size of around 17 to 18 millimeter is achieved by majority of the eggs, we give an injection what is known as a trigger. Trigger is an injection which is given for maturity of the eggs. So it's a very, very important injection, should be taken properly. You should be aware of the timing which has to be taken, the route with which it has to be injected, and the dose what is required. So total clarity should be there. There should be no confusion. Why this trigger injection is important? Because the next step, which we call as oocyte retrieval or egg pickup or ovum pickup or OPU in short form, are all dependent on the timing of the trigger. The oocytes are retrieved or picked almost 34 to 36 hours after the trigger injection. Usually we prefer to do the pickup within 36 hours to avoid the release of these oocytes. So this what does the ovum pickup procedure involve? This is a daycare procedure, that is involves a daycare admission. You don't need to be usually admitted overnight. Then this procedure is done under short general anesthesia or light anesthesia or sedation, monitored by the anesthetist. It is a pain-free procedure because it is done under anesthesia. We do pick up the eggs by means of a fine needle which is passed under guidance of ultrasound. So then these egg sacs or follicles are pricked and the oocytes are retrieved by means of a fine suction. Once these oocytes are received, they are passed over to the embryologist, who puts these oocytes in a dish which contains the nutrient media. In fact, it is like the food for the oocytes so that they remain fine, because everything has to be properly monitored. So the embryologist checks for the oocytes and picks them and keeps them in a dish, and then he places them in the incubator. Then the next step involves fertilization. The sperms are taken from the male partner, and then these sperms are washed and properly prepared, and then there are two procedures. One is the basic IVF, which is in vitro fertilization, in which the embryologist puts the sperms along with the eggs and leave them to the natural process of fertilization. This is IVF or in vitro fertilization. There is another specialized procedure we call as ICSI. ICSI stands for intracytoplasmic sperm injection. Here the mature eggs is injected inside the sperms. So this is very useful in case the sperm counts are low or the motility is low or normal sperms are low, and otherwise also it generally improvises the success rate. So it is the embryologist's choice what procedure he decides to do. Once the fertilization is done, the embryos are placed back into the incubator, which is almost like the environment is like a mother's womb. Then the monitoring of the embryos is done to check how they are growing on day 1, day 2, day 3. The day of pickup is considered day 0. The next step is embryo transfer. That is, once the embryos have grown to the stage of day 3, that is, they have grown for day 3 days, or we say blastocyst, which involves 5 days of growth. Then they are placed back inside the uterine cavity or the womb. This procedure of embryo transfer is a simple procedure, specialized procedure, painless procedure. That in this, a fine silicone tube is passed through the mouth of the uterus, and through those the embryos are passed, and under again guidance of ultrasound, the embryos are placed at the best part of the uterine cavity. So this procedure is a very simple procedure. Once your embryo transfer is done, you can go back home, and then there is the next phase of luteal phase support. In the phase of luteal phase support, we give certain injections and gels and medicines to support the embryos so that they implant inside the womb or they stick to the womb and you achieve a pregnancy. The luteal phase support also helps in maintaining the right environment for the embryos. And last but not the least step is checking what is the report card or what is the result of the IVF procedure. The test. So pregnancy is confirmed by means of a beta HCG test, which is done 9 to 11 days post transfer if you are doing a blastocyst. That is, depending upon if it is a 5-day embryo which you have put, then the test would be done 9 to 11 days later, and if it is 3 days embryos you put, you will test around 11 to 13 days later. So that is the time of great surprise as to whether your IVF has been successful or not. So generally this procedure is a simple but specialized procedure, involves a lot of steps which can be dealt easily. Well, how much time it involves? Well, if everything goes fine and we are doing a pickup and the transfer in the same cycle, then it involves a single ovulatory cycle, or you can say almost 24 to 28 days. But if due to any reason we are freezing the embryos and transferring in the next cycle, then the time may become more. So which are the usual cases where you may have a staggered cycle is when maybe you are a patient of PCOS, and then what we prefer is to freeze all the embryos to decrease the risk of OHSS, which can be a serious condition, or if there is a hormonal imbalance, the progesterone level at times might increase too early, or if the endometrium or the lining of the uterus is not well developed. In short, if the environment is not optimal for an embryo transfer or implantation, then the embryos are frozen and may be transferred in the next cycle, in which case the time to pregnancy might be slightly increased. So these were the basic steps. I hope they would have given you an insight as to what are the steps of IVF. If you have any further queries, I'll be more than happy to answer these questions, and you can write them in the chat box and we will try to answer them to you. If you have liked this video, do share, like and subscribe our channel Gunjan IVF World.